CardioSense, an AI-powered cardiovascular disease risk prediction system built with React, FastAPI, machine learning, and PostgreSQL. This is the CardioSense dashboard, a real-time overview of every patient and assessment in the system. At a glance, you can see total patients, total assessments, and the average risk probability across the population. The risk tier distribution shows how patients are split between low, medium, and high risk. Gender and blood pressure category breakdowns help clinicians spot patterns at a population level, while the assessment trend chart tracks activity and average risk over the last 30 days. The Patients section lists every patient on record, each with a unique patient code. A quick search lets you find anyone by name or code instantly. Clicking View opens a patient's full profile, including their contact details, demographics, and history. Everything a clinician needs before running a new assessment. Adding a new patient takes just a few fields. We enter the patient's full name, date of birth, and gender, along with optional contact details like phone, email, and address. The form validates entries as you type, so nothing critical gets missed. Once we click Save Patient, the new record is instantly added to the patient list, ready to be used in a risk assessment. Now let's run a new risk assessment. We start by linking it to a patient ID, then enter their vitals, height, weight, and blood pressure, both systolic and diastolic. Next, we add lab results like cholesterol and glucose levels, followed by lifestyle factors, whether the patient smokes, drinks alcohol, and how physically active they are. Every one of these inputs feeds directly into the machine learning model. Once the form is complete, we click Run Risk Assessment, and CardioSense gets to work analyzing the data. Here's the result: an 82% risk probability, flagged high. This score comes from a voting ensemble model, and CardioSense doesn't stop at just a number. The SHAP explanation chart breaks down exactly what's driving the score. Systolic blood pressure and age are the biggest contributors here, shown in red, while factors like activity level and healthy cholesterol pull the risk down, shown in teal. Below that, personalized recommendations translate the data into clear, actionable next steps for the care team. Every assessment can be exported as a clean, shareable PDF report, complete with patient details, the risk result, the SHAP explanation, and recommendations. It's ready to print, attach to a patient file, or send straight to a physician. Back on the dashboard, the numbers have already updated: a new patient, a new assessment, and a fresh risk probability, all reflected in real time. This is what makes CardioSense practical for everyday clinical use. Every new case immediately becomes part of the bigger population picture, helping care teams track risk trends as they happen. Looking ahead, CardioSense is built to grow, with planned features like SMS reminders, doctor login access, a mobile app, and full cloud deployment. Thank you for watching.